Hello, everyone. Good afternoon. My name is Leonardo Bedoya, and I will be doing choice one synovial joint. And I will be doing the knee joint or tibiofemoral joint, which is right here. So the tibiofemoral joint has three articulations: the patellofemoral joint and the medial and lateral tibiofemoral joint. The patella articulates with the distal femur and helps protect the quadricep tendon from friction against the femur. The tibiofemoral joint articulates with the rounded condyles of the femur and the flat condyles of the tibia, both laterally and medially. The rolling of the femur on the tibia produces either flexion or extension of the joint, and gliding of the femur on the tibia stabilizes the joint when weight bearing by aligning the condyles in the center of each other. So you can see right here, this is the medial, lateral tibiofemoral joint, and the patellofemoral joint. So the tibiofemoral joint is a hinge joint because of the convexity and concavity of the femur and tibia that allows for movement only in one plane, the sagittal plane, or on the x-axis. Flexion and extension are the movements the knee produces, and therefore it is a uniaxial joint. The knee joint does have a unique feature which basically rotates the femur medially against the tibia when the joint comes to full extension. So basically, this is flexion, this is extension, flexion, extension. The x-axis would be right here horizontally, and the sagittal plane would be like this. Next. So here's the x-axis, extension, flexion, bend. So major ligaments. So one of the four major ligaments of the joint is the ACL. It assists in preventing anterior translation of the tibia on the femur, which can lead to hyperextension, but it also prevents as well rotation of the tibia on the femur. It is located within the joint at the condyles anteriorly to the PCL. And the posterior cruciate ligament is located posterior to the ACL and functions to prevent posterior translation of the tibia on the femur. The medial collateral ligament or tibial collateral ligament helps to resist forces that push from the lateral side, and it's connected to the medial epicondyle of the femur and medial condyle of the tibia. And the lateral collateral ligament or fibular collateral ligament helps resist forces that push from the medial side and is connected to the lateral epicondyle of the femur and head of the fibula. So the posterior cruciate ligament, anterior, medial, and lateral. And then some important anatomical features are the meniscus, lateral meniscus, and the medial meniscus. So the meniscus, there's a medial and a lateral meniscus, and they are attached to their tibial condyles. They function as shock absorbers. It provides lubrication, and it makes the articulation concave instead of flat, and it improves the weight distribution. So these are all things to help the knee feel more movable and reduce injury from constant weight bearing. Yep, that's it. Thank you.